morning. My name is Michael Nyongesa. I am the president of Kenya Progressive Nurses Association. We are an association, a professional body, and our main agenda in healthcare is to ensure that nurses provide quality of care. And for this to happen, is that nurses must gain skills and competencies to be able to perform at their maximum to serve our clientele and to serve our patients. And so we achieve professionalism through different ways. One of the ways is having annual scientific conferences where we meet to share our best experiences, our good practices, our research papers, for us to be able to really know and what is happening in different parts of this country and world over. So we have scientific papers that we go through. Number two is we do continuous medical education, physical and virtual. The physical ones we do in the hospitals, and the virtual ones we do online, where we bring nurses from across the country for us to learn together, more especially on issues which are emerging and on issues which are bedeviling our country. We want to discuss, have discussion around for us to be able to give direction and to impart skills, knowledge and competences for this to be able to happen so that our common mwananchi is taken care of well and we are providing quality of care. Number three is that we also have a school called KPN Academy. It's a virtual school where we have posted courses where a nurse who has credentials logs in and is able to study some short courses for purposes of increasing their knowledge and increasing their competence. We also partner with our partners to go around the country for physical lectures. Like we partner with the DKT International, and we go out around the counties, training every county. We train at least 120 nurses in terms of long-term methods of family planning. So these are part of the ways that we are using to be able to have nurses have the right skills, the right competencies, the right knowledge for them to be able to serve the clientele and our patients well. Now, why we are here in this Kisii is that we have an annual scientific conference. And the annual scientific conference talks about the future of nursing in relation to evolving education and evolving practice. Things have not remained constant. Things have become dynamic. New diseases, like recently we had COVID-19, they are coming on board. And so the training, the education nurses go through must be aligned to what is going on. So we have this discussion here. And number two, when there are changes in the healthcare in terms of diseases, in terms of conditions, then we must also change the tact on our practice. We must improve and have newer ways looking at the horizon for us to be able to have relevant practice, quality practice that will be able to meet the needs of our clients and the needs of our patients. So our discussion here in this conference is about the future of nursing in relation to evolving education and evolving practice. We have global scholars here in this conference. We have local scholars in this conference who wants to share to this conference the best practices that we have, the changes that we have based on research, what is working, what is not working. And this also informs our schools. That's the middle level and the higher institution of learning. Also, what we study here, what we discuss here, it provides information to the institutions. So that in terms of issues of education and issues of practice, the schools can also capture, because we're a profession that is growing, that is not static but dynamic. So those are the kinds of we have. We have our governor, His Excellency the Governor of Kisii. He's not around, but we have postponed our opening ceremony to tomorrow because he has indicated that he may be around tomorrow, so that he can also come and listen to the nurses and also share a moment with nurses, because alone as nurses we cannot go far. But with collaboration with our employers, with our governments, it becomes easier for us to have a discussion and a conversation on how we can be able to move healthcare to a higher notch. So that is basically why we are here. When you look around, we have several partners who have come on board to support us. And we want to appreciate ATC, Kisii Agricultural Training Center, for having even given us an opportunity to be here. They are making food for us from the farm, and they are very hospitable